I like to talk about a major review rather than an annual review, because sometimes for people with well-controlled epilepsy, they don't need to come and see us every year. So, the major review in general practice, the first thing we should do is to just check that we have got the correct diagnosis, that we've got to know if there is a cause and what seizure characteristics there are. And if any of us leaf through the letters for people with epilepsy over the years, we will see that different hospital staff, various training grades, have named seizures differently, either secondary generalised, idiopathic generalised epilepsies. So we've got to check and see exactly what the diagnosis is. We've also got to check that the diagnosis is epilepsy, because if people have continuing seizures despite drugs, it may be that they have seizures for other causes. So we then ask them about their seizure control. Perhaps they may have a seizure diary. Certainly they may keep a note of any episodes, and we want to know if that's changed or if there's a problem. So we want to know if that's changed or if there's a problem. Seizure control, self-report of seizure control is of course open to caution, because a patient has got no benefit in telling us of a seizure, because they would lose their driving licence, their employer might have a problem, and then they may have to spend some time waiting for referral back into hospital. But that's the only measure that we have. We ask them about their epilepsy medications, and the best way of doing this is in a non-judgmental way, simply saying, and how are you taking your medicines at the moment? We've got to check that our records are accurate, so we know which tablet or tablets they're taking, whether they have any side effects, and if they're taking them as prescribed or if they've chosen to take them in a different way. We've talked about serum blood levels being of no use at all, other than to check and see if people are taking the medicine. And the only other use is if somebody's on phenytoin and we're thinking of altering the dose of phenytoin, because it's a narrow therapeutic window. We've got to make sure that they've got all the information that they need. Not that we have got to tell them all that information. We probably don't know it. But to know that they've got access to web pages or to information sites, and that they know of all the information they should require. We should ask briefly about whether there are any changing circumstances in their lives, any leisure activities or any change in employment, whether there is the issue of driving, and of course for women the issue of conception, contraception and planning pregnancy. We then agree a care plan. In other words, are they happy to continue with the medication? Do they want to up or down the dose if there are side effects? And when would it be valuable for them to come back and see us? So that return, that follow-up date can